A battle for truth and understanding is unfolding in the world of autism advocacy, and it's time to shine a light on the issues at hand. The rise of misinformation, a threat to progress. When the Centers for Disease Control and Prevention, CDC, made a surprising change to their website, echoing the beliefs of Robert F. Kennedy Jr., a well-known anti-vaccination leader, autism advocates knew they had to take action. Kennedy's claim of a link between vaccines and autism, a theory long debunked by science, sparked a wave of concern and activism within the community. Advocates speak out, demanding recognition. Leaders from various autism organizations, such as the Association of University Centers on Disabilities and the Autistic People of Color Fund, took to social media and online platforms. They called for public health officials to listen to the voices of autistic individuals and to recognize the impact of Kennedy's statements on the disabled community. The Autistic Self-Advocacy Network, ASN, boldly stated, "Kennedy's lies endanger public health. A game of whack-a-mole, combating misinformation." Advocates describe their efforts to combat autism misinformation as a never-ending game. Since Kennedy's appointment as head of the Department of Health and Human Services, they've had to shift their focus from building autism awareness to countering harmful rhetoric. Maria Davis-Pierre, an autistic mental health therapist, emphasizes, "We have to constantly refute RFK's information to protect our community." The history and challenge of autism advocacy. Autism spectrum disorder, first identified in the 1940s, continues to be a topic of education and misunderstanding. Advocates dedicate significant time to explaining what autism is and isn't, a role that has become increasingly challenging due to persistent misinformation. Autism is a developmental condition affecting communication and behavior, ranging from individuals who can live independently to those requiring support due to severe symptoms. Despite clear diagnostic criteria established in the 1980s, the autism recognition movement faced a setback in the 1990s when a flawed study suggested a link between the MMR vaccine and autism. This study, later retracted, has led to a persistent myth that vaccines cause autism. The impact of Kennedy's influence. Kennedy's influence has given new life to this myth, causing a surge in advocacy efforts. Zoe Gross, director of advocacy at ASN, describes the impact. "When Kennedy makes these statements, I spend weeks answering press inquiries. It's disappointing to fight the same battles I fought when I started 15 years ago." ASN and other organizations have released numerous statements and created accessible materials to counter the administration's claims. The Autism Science Foundation has even partnered with the American Academy of Pediatrics to design tools and infographics to reassure families that vaccines are safe. Autism, a neurological disorder, not a disease. Since Kennedy's appointment, the administration has framed autism as a chronic disease that needs investigation. However, advocates and researchers emphasize that autism is a neurological and developmental disorder, not a disease to be cured. In April, when the CDC released its report on autism prevalence, Kennedy's response, calling the rise in autism cases alarming and attributing it to environmental toxins, sparked further advocacy efforts. The power of storytelling and education. Autism Empowerment and other organizations have taken a multi-pronged approach. They share evidence-based information and help autistic adults share their stories through publications like Spectrum Life magazine and community events. This storytelling approach is a powerful tool to counter misinformation. Advocates push back. The National Autism Database. When Kennedy proposed creating a national autism database, advocates responded with a Change.org petition, highlighting the potential risks of such a registry. They explained how it could be used to track and restrict autistic individuals' participation in society. Kennedy eventually reversed his decision, likely influenced by public outcry. ASN wrote, "Speaking as though our existence is a calamity is a form of eugenics." The impact on communities, fear and misinformation. Maria Davis-Pierre, an autistic advocate, shares her concerns about the impact of fear-mongering on diagnosis rates, especially within the Black community. She believes the administration's claims will lead to gaps in diagnosis and support networks, making it harder for families to access the help they need. Addressing real challenges, access and resources. Advocates are pushing for a shift in government focus from disproven theories to tangible efforts that improve the lives of autistic individuals. Significant challenges remain, including limited access to health services, long wait lists for diagnosis, shorter life expectancy, and barriers to employment, housing, and food security. The Autism Society of Greater New Orleans has seen success in boosting vaccine confidence and access through a comprehensive program. They vaccinated over 2,000 people, trained medical professionals, and distributed vaccine kits to reduce anxiety and pain for autistic individuals. Advocacy and political action. Advocates are turning to political action to address these issues. Some organizations are calling for Kennedy's removal, while others are meeting with elected officials to share their concerns. The sudden communications freeze with the health department has left advocates without a direct line of communication, but they remain determined. The impact on individuals, a personal story. Tanya Haynes, an advocate with Autism Speaks, shares her son Tyler's story. Tyler, an autistic young man, has graduated from college and is employed. Haynes emphasizes the impact of seeing Tyler in person, saying, "The impact is instant." A broken promise, Kennedy's concessions. When Kennedy was confirmed as health secretary, Senator Bill Cassidy cast the deciding vote, but only after Kennedy made several concessions, including leaving the CDC webpage stating vaccines do not cause autism intact. Now, with Kennedy breaching that promise, Cassidy has expressed shock but refuses to directly challenge him. Conclusion: a call for action. As advocates continue their fight, they emphasize the harm caused by framing autism as a disease to be eradicated. It's a battle for understanding, acceptance, and the right to live without fear or misinformation. Framing autism as a disease is harmful. It's time to shift the narrative and focus on supporting autistic individuals in living their lives to the fullest, says Claire Tibbetts, Executive Director of the Autism Society of Greater New Orleans. What are your thoughts on this ongoing battle for truth and understanding? How can we ensure that autistic individuals receive the support and recognition they deserve?